if your desire was to try to get rid of your contacts or your glasses and be able to see clearly without them, then there are several procedures that can be done that will correct the refractive error if you're a good candidate. So you would need to talk with your ophthalmologist about checking and doing the screening test to see if you're a good candidate. One of the most popular procedure I think most people have heard of is LASIK,
Yes.
and it's an excellent procedure. The way that it's done is that the cornea, which is responsible for 2/3 of your focusing ability, if you change the power of the cornea, then that can correct someone's refractive error. And so LASIK is using a laser to reshape the cornea to change the power that it has. And it is done first by creating a flap with a laser procedure, and then the other laser will actually, once you reflect that flap, will reshape the cornea down to the micron that has been determined that needs to be done in order to correct the refractive error and astigmatism. And then that thin little flap is put back into place, and it's got a hinge on it, so that's what kind of keeps it in place. And then usually people see well enough to drive even the next day. Often they're 20/20 by the next morning.
Wow. Now, how often do you get it right first time? Because you're talking tiny, tiny...
Down to the micron.
Microns, I mean.
It is somewhat dependent on the magnitude of the refractive error. So the higher the amount of astigmatism or the amount of hyperopia or myopia that you have, then the percentages that you would need an enhancement are a bit higher. But overall, I would say 96% do not need an enhancement. It's
enhancement meaning
a second treatment.
Kind of second,
right, second treatment.
Redo the same thing, but just shave a little bit more. Or,
right.
Yeah. And how long after the original procedure would an enhancement be done?
So typically for LASIK, I would have somebody wait at least 3 months so that everything is as settled as it's going to be and that there's not going to be any more changes, that I've had several readings that show the refractive error is stable, and if there is still some refractive error left, then we could go back in and lift the flap and do a little bit more treatment if necessary.
And what's the recovery period? Is it 3 months? Is that how long it takes to heal and everything, or is it much shorter than that?
The recovery period, the immediate postoperative period, I want to see them the first day after surgery to make sure there's no sign of infection, that there's no wrinkles in the flap or no inflammation underneath it, and to check their vision and make sure that everything is healing properly.
That shows up already on day 1?
Yes.
Wow, the
yes.
eye is special.
And then I tell them ahead of time, I said I'm very strict about that 1-day appointment, 1-week appointment especially, because if there's problems I can correct them early on and head them off at the pass, although most of the time there's not problems, but that's why the follow-up's important. And then I also require them to see me at 1 month, 3 months, 6 months, and 1 year. But those are mostly to make sure that the refraction is stable, that the vision's stable, and that they're doing well and not having any issues with dry eye or other problems.
Now, does someone who's had this procedure still go on to get presbyopia at about the age of 50?
That is a good point to bring up. This procedure will correct the refractive error so that if you're still in your 20s or 30s, that you'll be able to see at all distances without glasses. But yes, then when you get into your 40s, you will begin to have presbyopia and you will start to need reading glasses. So that doesn't mean the LASIK went bad. It just means that you're aging. Although if you have the procedure done when you are in your 40s already and you wanted something done similar to the contact lens monovision that we were talking about earlier, that could be done with LASIK. But you would have to make sure that you had tried it in contact lenses first to make sure you liked it before you would have it done with the LASIK.
Wow. But that would only be an option if you'd already had LASIK before, is that what you're saying?
No.
Or anybody could have it?
If they hadn't had it and they were in their 40s and they were considering have it done, then I would tell them at that point, because of their age and the fact that they would appreciate monovision at that point, when somebody's in their 20s and 30s, they wouldn't appreciate that. They would not like that. They would not be happy. But if they're in their 40s, then I think it's important for them to understand that they have options and that either both eyes would be fixed for distance and that they would need reading glasses, or that they could do the monovision thing as long as they try it ahead of time in contacts.
Are there any serious complications with LASIK?
So there are some serious complications. They're very rare, and there's been a lot of studies done to compare the lifetime risk of wearing contact lenses versus the risk of doing the LASIK, and actually LASIK is safer as far as infection goes and potential complications. The most serious complication will be if you were to get an infection in the cornea, which could cause permanent scarring and loss of vision, and that's why I'm very strict about the follow-up and making sure that people see me when they're supposed to see me so that I can check for those things.
So that could be preventable. If you catch it early, you could prevent that serious complication.
You can treat it. You can treat it. You can't totally prevent infection, but you can treat it, and the earlier you catch it, the better the outcome's going to be.
Right, and the less likely there is to to be blind. Are there any options other than LASIK?
There are. So there's other things that I'm sure people have heard talked about, such as PRK, and that is something where you don't do a flap, and it's potentially good for people who don't have a thick enough cornea to accommodate doing a flap and then the reshaping. So then they would just remove the very surface skin, do the reshaping with the laser, and let the surface skin grow back in. And then that's a procedure that people can have done if their corneas are not quite thick enough for LASIK, and it still works. Their vision doesn't recover quite as instantly as LASIK does, so that post-op day 1 and even up to day 3 and 5, things are still blurry. And sometimes it can take people several weeks before it really gets sharp, depending on how long it takes that surface skin to heal and remodel. But it still has very good results. It just takes a little longer to get there.
And it sounds a little bit more painful too.
It is more painful.
Thank you. We've learned lots today. It's been great having you back on the show. Thanks for your time.
You're welcome.